Our proposal is on acupuncture and its application to pregnancy and childbirth. Our group members are Jolene Beck, Mariah Amther, Megan Asnes, and Tempe. Temmie. Oh my gosh, I'm not even gonna say our names because apparently I cannot say our names. So they can just read that. Let's go back. We do not need to, Our proposal is on acupuncture and its application to pregnancy and childbirth.
So the research question that our proposal is centered around is, could the practice of acupuncture in Oriental medicine during the stages of pregnancy and birth decrease the use of pharmaceuticals, promoting a healthier, more holistic form of care for families? So this topic is important to nursing because there is evidence that suggests that acupuncture can help alleviate general pain and discomfort during pregnancy. So this really offers a more holistic way to manage those typical signs and symptoms of pregnancy and of labor without those risks of adverse effects from various medications. And going along with that, something important to consider is that many pregnant women are excluded from drug trials because pharmaceutical companies don't want that risk and liability of harming the fetus. Therefore, many pregnant women don't get adequate pain and symptom relief. So there really needs to be more alternative options available and accessible to pregnant women, and acupuncture is one of those options. So Jolene did her lit review on this, and she actually was able to do a personal interview with an acupuncturist. And she found out through that during labor, acupuncture can help keep labor moving and it helps with pain. And then for those postpartum women who use acupuncture, it can increase their energy, decrease pain, and then facilitate milk letdown and milk production. And then in 8 years of this acupuncturist practice, she had not seen a single adverse effect, which is very significant. And then she also went through a descriptive quantitative study. And she found out through this study, out of the 304 people that responded, 68% used acupuncture for concerns and symptom management during pregnancy. And then 89% said they would consider using acupuncture as a means to decrease the use of pharmacological interventions and adverse birth outcomes. And then lastly, she looked at mental health during pregnancy, and it was found that varying moods, so like anxiety, depression, can be a major cause of disability during pregnancy. Specifically, it can lead to intrauterine growth restriction and impaired development of the fetus. And what's significant about that is many mood stabling medications are teratogenic, so they can't be used during pregnancy. So this leaves a lot of women without that kind of symptom relief, which can lead to adverse effects on the fetus. Some strengths and weaknesses of the lit review. A strength was that the evidence presented, it really supports the idea that acupuncture during pregnancy can decrease that need for medications. But the weaknesses is that there has been little research done in the US regarding acupuncture. So really the purpose of our proposal and our study would be to find quantitative data and use it for as it can create more concrete evidence for the use of acupuncture, specifically in pregnant women. So this goes right into the purpose of our study, which is to examine how pregnant women experiencing those common signs and symptoms of pregnancy respond to acupuncture compared to those who do not receive acupuncture. So specifically, we're going to look at how those common signs and symptoms change upon receiving acupuncture.
Sorry. All right. Our design. So when looking at our design, we really wanted to figure out if we were going to do a qualitative, quantitative, or a mixed. Our proposed design would actually be quantitative. As Megan discussed, we want to pull in that hard concrete evidence to show that this is a true method that can be used to provide the relief that we were looking for. So kind of going with that, we want to have the reliability of charting results for that symptom or pain relief. Our specific design and rationale, we are proposing a randomized control trial. it is our hope that we can find a select target group that will meet the criteria, and then be able to split them between the control group and the experimental group, with the control group not receiving acupuncture for symptom relief, and the experimental group will receive that therapeutic treatment. By using the control group, we were able to rule out any mediating or intervening variables that would compete with our independent variable of acupuncture treatment, which we were hoping would show and produce reliable and repeatable results. So we could, again, repeat this study later on, get more volunteers, get more actual evidence and statistical data to prove it works. Our sample procedure would fall under simple probability sampling of the pregnant mothers, and we could pull them from first, second, and third trimesters. The key with that, and including everyone across the spectrum of pregnancy, is that some pregnant women experience symptoms initially just in those first 13 weeks, the first trimester. Others can experience it more towards the third trimester. And then there are those unlucky mothers who experience symptoms of nausea, vomiting, back pain, headaches, and all of the entire gamut throughout their entire pregnancy. So by including mothers from each trimester, it really helps give us more of that generality that we're looking for in our target population, which we discuss in the next paragraph there. We're really looking at pulling approximately like 100 mothers that are pregnant that we can split between our control group and experimental group. We do feel that 100 would give us, again, that good generality of the population, but we also want to keep in mind that general acupuncture treatments can last anywhere from 30 minutes to 60 minutes. So it is requiring a lot of time to collect that data, especially if we are doing repeat treatments in a week, once or twice a week, or just once a week. We still want to make sure we have ample time to collect the data required. Our sample selection would make use of informed consent, as each participant would definitely be a volunteer. We were looking at going to local clinics, birth centers, and asking them if they could make our study know, and we could really pull patients from there, and then have them sign an informed consent document, as acupuncture is a form of therapy that does involve needles puncturing the skin. And anytime there's any sort of treatment that breaks a barrier, clearly there's a risk for infection or other side effects. So we just want to make sure that we have their consent and they are informed as to what's going on in the study, why we're asking them to be in the study, and everything that makes up the study and what we're going to be looking at, just so they know ahead of time what they can expect. Lastly, for the sampling population, we have some ethical considerations. And the biggest thing is we want to protect our human subjects. And a lot of this, again, would be that education of the actual therapy and the procedures that will be taking place. We want to discuss the risks that are involved, and then signs to watch for if they have any adverse reactions to acupuncture. Again, as we stated in the initial description, within the 8 years that the acupuncturist we had interviewed had been providing acupuncture for pregnancy and postpartum, she has not witnessed any adverse side effects or any issues, but there always is that risk. So we do want to make sure people are aware and know what to do and when to do it. And then as far as identifying that it's a random controlled trial and patient preference is not going to be a factor in the study. So if you sign up to be involved, you could be placed in either one group or the other, and your preference really isn't going to make a difference. Like if you want to be in the acupuncture group, there's no way of guaranteeing that. And that just helps with the validity of our sample and making sure that we can really pull in accurate results for our study.
Okay, for the data collection, we'll be doing a self-report questionnaire and from our population, and we're considering using like 100, just as Jolena said. And we'll be just mentioned doing a randomized trial. That means groups will be randomized. So it can never be like basically on each person's preference, whether you want to use a paper and pencil or you want to use the electronics too. So the questionnaire will be available in both forms. And we'll be reporting on 5 items, which is nausea, vomiting, back pain, headache, and insomnia. The questionnaire, as said, will be given to both 50 groups, 50 on each group. The experimenter is 50 women, and also we hope to have 50 for the control. And the participants will be answering the questions based on their experiences with pregnancies after they receive the interventions within a period of 20 to 30 minutes. Hopefully, we'll also be making sure that they are in a very good environment so that they are not like, there are no biases and there are no influences coming from external to influence their decision making. We'll be using the 5-point Likert scale, with 1 indicates strongly agree to 5, strongly disagree to 5, which indicates a strongly agree. Will be used to score each of these experiences on the item in consideration. So this is a sample of the questionnaire that will be handing off. The first one will be, they'll be able to answer this question, made it so simple so that they won't have to like reason too much before they answer it. So the first one will be asking, I received nausea during pregnancy. So you either answer strongly agree, strongly disagree. So the second is I received backache relief during pregnancy. So it ranges between strongly agree and strongly disagree. So they'll be given this either in electronic form, as I said, or in pencil and paper. Okay, so the reliability and validity of this test is one of the things that we are concerned about, and that's why we switched to do it in the quantitative form. And we'll be using the Scrumback alpha to measure that, and then a coefficient value of 0.92 or anything greater after analysis will indicate that the intervention treated the symptoms. And after doing that, we also do a statistical, we'll go further to do an inferential statistics to test for the hypothesis, whether what we actually saying, that is the acupuncture, was he able to relieve the symptoms, or did he not? We'll test for these hypotheses using the statistical inference. And if after we do the statistical analysis, if the symptoms of, if the statistical testing, if the acupuncture intervention treated in the experimental group, that if the research, I'll just say it in lip form, that if the research hypothesis is no, it's no, then we want, I think I bumped this. I'm sorry. It said, an inferential statistic is then conducted to test the research hypotheses, that is the effect of acupuncture intervention treated pregnancy symptoms in the experimental group as against the control group, with the statistical non-hypothesis. If there's no difference, we either reject or we accept the non-hypothesis. I think I'll just withdraw conclusion on our research by simply the data collected from the groups in 3 nominal categories. Either we agree or we're neutral about it, or we disagree. Then we use a child test to test the differences between the experiment and the control group to determine if the observed distribution of the data is found as each category is different, what we expect by chance.
Some ethical and political issues. Jolene kind of touched on this earlier, but it's not uncommon for you not to find a lot of research on pregnant women just because there's a lot of fear for the risk of the fetus. As stated earlier, we're going to use an informed consent. So all women who are going to be involved are involved on a volunteer basis. And then we're going to have them sign a form just to make sure that they understand everything that's going on. And then also, because it is a volunteer basis, we're going to have people from all different cultural backgrounds. So we just want to make sure that everybody feels welcomed and that they understand what's going on in the study. So if an interpreter needs to be present, we'd want that, just so that they were informed on what it is that they're signing up for. An analysis of the plan is we're just going to choose the question that we want to research. We're going to decide what and how to measure. We're going to analyze the data, and then we're going to interpret the results. And then some limitations includes the sample size. So we do have like a decent amount of people, 100 joining, or what we plan on volunteering for it. And this could mean that it could put people more at risk for adverse effects. I mean, obviously, as stated earlier, there hasn't been shown any adverse effects, but doesn't mean that's not possible. There's also a lack of previous research shown in the study, especially here in the US. And then there's a time constraint because we are focusing on pregnant women. So we only have within a 9-month time period to kind of get the data on the women who are involved. And then also there could be a cultural bias based on people's own cultural beliefs. And that concludes our presentation.
Sorry, guys, I messed up.
That's okay, because Jolene, I realized, because I changed in the slide,